Hey everyone, thanks so much for joining me on the Slice of Healthcare podcast. I'm your host, Taylor. Joining me today is the co-founder and chief strategy officer of DispatchHealth, Kevin Riddleberger. Kevin, how are you today?
Great. Thanks for having me here.
Super excited to have you here today. Let's dive right into it. Tell us a little bit about your background.
So background, headquartered here in Denver, Boulder, Colorado, clinician by training. So practice as a physician associate for a little over a decade. Was in the institutional space, seeing patients in the hospital, ER, seeing patients in the ambulatory setting as well. So really, understand the good, bad, and ugly, around healthcare as a clinician on the front line. Understand the challenges, around patient throughput, patient, care in general. Went back to business school to kind of understand the third leg of the stool, and that's kind of how the flow of funds really work. Transitioned to a company after B school. It's a startup company when the iPhone was cool, the mobile app space was really cool, which is a company called iTriage, which was building a symptom processor and really a health literacy tool to help patients navigate to the appropriate level of care. Understood how software development played into all of this, and caught the bug, the startup bug, and started Dispatch Health back in 2013.
So interesting. Yeah, and I was telling you, I remember I heard about you before this, but had someone like passionately talking about what was cool about what you were doing was our mutual connection, Dr. Amal Agarwal. And that was a couple of years ago. So it's great to finally, connect. Not that we were, trying to actively talk with each other during that period. So I'm glad this happened though. Talk us through, obviously you've come a long way since starting the company. Where are things at today? What's the core focus? What excites you, the most about the business and opportunity?
Yeah, the vision of Dispatch Health is to deliver a tech-enabled service into the home, and not just deliver a single service. It's really a system of care inside the home. So we started and got some traction in the pre-hospital space, identifying patients with high medical need, high social needs that didn't need to be in the emergency department. So if you look at industry data, depending on the article you read and the population, you're looking at about 37 to 70% of patients don't need the emergency department. 17% of those individuals will call 911 and have an ambulance send them to the emergency department that really don't need to be transported at all. And so we looked at that space, the opportunity to be able to do things differently, meet patients where they're at, and that's inside the home, being able to save money and deliver a high quality service. So that's what really Dispatch Health is well known for, is that in that pre-hospital space. We've scaled that all across the country, 50 plus markets, 30 states. We'll see our millionth patient here coming up since the inception of the company, which is pretty cool. But have evolved that vision over the years to identify high acuity patients coming out of the hospital, to prevent readmissions and bridge them back into the primary care physician specialists. So we've seen 30 to 40% improvement in readmission rates when we intervene on those patients 24 to 72 hours after that hospitalization. So high value there. The last few years has really been building out and delivering and scaling our hospital home program. So this is enabling health systems within the CMS waiver, but also contracting directly with Medicare Advantage plans, commercial plans, that we could see in the community, admit from the home to the home without ever stepping foot into an ER, and to deliver that level of care. Same hospital clinical acuity, but deliver that in the home setting. So we've been scaling that to now be in 13 markets, delivering that care. Made a couple tuck-in acquisitions the last couple of years through Last Mile Imaging. So we're now, I think, the second largest portable imaging company delivering X-ray ultrasound inside the home. So it's really starting to kind of round out, that system of care from pre-hospital, hospital substitution, as well as post-acute services inside the home.
And what is, this has been something that you've been talking about for a number of years, right? But it seems like it's been especially gaining steam from just the broader healthcare industry over the last just even like 1 to 3 years, right? It seems like you can't go a day without talking about care in the home. Um, Talk us through kind of what the future of care in the home looks like through your point of view.
Yeah, I think when you think about legacy, pieces of care in the home, it's really two things. It's skilled, home health, or it's home based primary care. And so those are the things that were in existence when we started Dispatch Health. But now, fast forward post COVID, there is so many different, clinical models being developed to be able to deliver that care effectively in the home. And, that ranges, from telehealth and access, 24/7 remote patient monitoring to SNF substitution, hospital substitution, chronic, disease, management, disease specific management, inside the home. So a lot of things, and it's really based on our vision, delivering that system of care in the home. And I think there's two things that are really driving that. Consumers are driving that. Consumers are used to receiving uh, different services inside the home. You saw that evolve from Blockbuster to Netflix to what Amazon has been doing, outside of healthcare to deliver services inside the home. There's no reason why healthcare cannot be the same, and consumers can't receive that, inside the home. So that's number one, the consumerization and the drive around that. And secondly, is really the amount of waste that happens in our system in the U.S. And it's following the dollar, and whether it be some of that waste, but also taking on risk and value-based payment. So as we start to manage populations more effectively, study after study after study demonstrates lower cost of care as well as better clinical outcomes with a great patient experience. And so you put all those three things together, lo and behold, Don Berwick, that's the triple aim. And so, that's the holy grail if you can start to hit all of those. And by the way, let's include, provider experience into that to combat some of our workforce, shortages. And then lastly, from a health equity, this is not for the privileged. This is for everyone. High medical need, high social needs. These are providing access, all income levels, and deliver that care in the home. So there's a lot of great momentum. Now a lot of money going into care delivery in the home. It's a sexy space to be in right now, as you talked about. So we're excited, with the growth. Excited that it was right timing for us to be able to scale our model in the home.
And with momentum, with being a, now sexy space, as you said, right? Challenges are, they become not more common, but they exist, right? And one of the things that we really like to do on the show is also dive into some of the challenges that still exist, right? Most of the time they're regulatory, just the nature of healthcare, right? But what challenges still exist that you're seeing? And I know you have lots of experience in not only recognizing these challenges, but coming up with innovative solutions to help solve them. But what challenges still exist?
Yeah, and I think we're still really early on care delivery in the home. I was just in Washington D.C., on Monday and Tuesday, talking with legislators, talking with heads of the CMS. There's still some work that is needed to be able to create an environment, payment models to allow for care delivery in the home to exist. And so there's a big push, and this administration showing a lot of effort, and putting value on care delivery in the home. So that's one. I think workforce shortage continues to be an issue, an area that we need to be innovating in. And that's really about keeping people practicing at the top of their license, making sure that we allow for that, making sure that we are leveraging our workforce as best as possible to extend our reach. The more that we can start to work together, in team-based care to help patients, the more effective we're going to be. So those are a couple things, and we're still pretty early, in value-based care. I talked about, that being one of the drivers of this, but all in all, we're still pretty early, in it. And as you start to shift the dollar more to population health, value-based care, this fits in really well into that puzzle. And you see a lot of big entities, investing in this space because they are also investing in value-based care.
What's next for you and for Dispatch Health? That I know you mentioned earlier what's excites you about the business, but what's next that you can tell us here today? That's a upcoming update, new update that you want to share.
Yeah, we're gonna continue to layer on all of those clinical services inside the home to deliver more and more value. And a good example of that is we recently launched our hospital home program in Tampa this month in April, and that's with a relationship with some of the payers down there. And again, it's helping with those at-risk provider groups, layering on different services that are valuable for them to keep people out of the ER, keep people out of the hospital, and we can do all that in the comfort of the home. So it's adding more and more additional value in the markets that we're already in, and going deeper in those partnerships with payers as well as health systems, moving forward. So we're heads down, and working towards that. This is a tough problem, from a logistics standpoint, and moving people from point A to point B. That's not in a brick and mortar building, is not easy. And so we're putting a lot of effort from a technology perspective to build the most robust healthcare logistics platform, to help all of the moving parts to deliver our care effectively and efficiently in the home.
Well, Kevin, I want to thank you so much for joining us on the podcast here today. Hopefully, we can have you come back on, do a panel, talk more about care at the home and some of the additional cool things that you're doing at Dispatch Health. Really appreciate it.
Yeah, thank you, Jared.